Hello everybody, my name is Tyler and I'm going to be presenting to you the comparison of the United States healthcare system and the Ireland healthcare system. The first PowerPoint here is just stating that I will be providing you information about an understanding of each healthcare system. Okay, so we're going to go on to the next one here. Okay, so what exactly is the U.S. healthcare system? The U.S. healthcare system is basically a system designed and developed for the population of our country to receive healthcare services. This allows us to get services provided by the government and funded by the government. It also provides healthcare insurances such as Medicare and Medicaid assistance, and it includes managed care insurance options in order for the population to be able to afford the medical services provided to them. Some managed care insurance options basically allow you to pay per month for the health insurance, and then you might have a co-payment with that as well when you go into the hospital or to a doctor's office. Okay, so what is Medicare? Medicare was created in the United States and implemented for citizens in the United States ages 65 and older. So this is geared towards the older generation, since they may need healthcare services more than the younger generation. Medicare is a government-funded healthcare insurance, so that basically means that it's free for those 65 and older. Citizens older than 65 must meet the specific requirements of Medicare in order to qualify. So yes, Medicare does have a qualification process, and each person must be in that process. Or I'm sorry, each person must be involved with that process in order to qualify for Medicare. Okay, so Medicaid. There's two sides to Medicaid. So Medicaid is a government-funded healthcare insurance developed for citizens in the United States who have low incomes. So this is for the lower class, people who make less than a certain amount of money per year. And Medicaid also assists with citizens residing in long-term care facilities. I personally have experienced Medicaid since I work in a healthcare facility and I'm always around Medicaid patients. They are specifically there for long-term, and they don't really receive any rehab or anything like that. They're just to basically live at the facility long-term or till the end of life. Okay, so Ireland's healthcare system. Ireland's healthcare system is a little bit different than the United States healthcare system. There are some similarities, and I'll go into that further. But Ireland's healthcare system is a system that provides free healthcare to all citizens who have lived there for at least 1 year. So this basically means that if you have lived in Ireland for a year or more, then you are entitled to this free healthcare, which means you will have free services such as going to the hospital, free prescriptions, free doctor's office visits. Ireland is very involved with the citizens of the country, and they really care about them. Okay. So Ireland's healthcare system continued. For citizens with less than a year of residency, Ireland provides flat rates and discounts for healthcare services provided. So this is a very great service that Ireland provides. So if, say for instance, you just moved to Ireland for and you've only been there for 2 months, Ireland gives you discounts for the healthcare services, so you don't have to pay the full amount, unlike the United States, where we have to basically pay the full amount if we don't have insurance or anything like that. And flat rates. Flat rates is a service. Basically, there's a set rate that every person who has less than a year of citizenship in Ireland has, and these flat rates really help because it's just a set number and it's easily affordable for everybody to have healthcare services provided to them. I wanted to touch on this as well. I believe the United States should partake in this service because, as you know, we have a good amount of people who have low incomes in this country, and it would really benefit practically everybody in this country to have easy and affordable rates for health care services. Also, discounts. I do believe we should have discounts for healthcare services as well, since the cost of our services tend to be a lot higher than other countries. Actually, the U.S. is probably the highest in the cost of healthcare services. Okay, so Ireland has a special relationship with Europe, unlike the United States, where it's just the United States and that's it. Ireland's healthcare system allows residents of Europe who have their Europe medical cards free healthcare services such as testing, emergency services, and prescription services. So if you are traveling from Europe to Ireland for an undisclosed amount of time, it could be probably a week, could be a month or two. Ireland, as long as you have your Europe medical card, Ireland will allow you to have free medical services in their country, which is awesome. I believe the United States also should really develop a service like this as well, because it will allow others to come into our country who might have different or higher rates than us, and it'll just allow them to afford healthcare services here. Okay. So Ireland and customer satisfaction. Ireland has a very high customer satisfaction rating regarding their healthcare services. 97% of citizens of Ireland are very satisfied with the quality healthcare services that they received from the healthcare system. This is a major factor and extremely important because customer service is the #1 priority. I mean, basically for any business as well. It all should be patient-centered in the healthcare setting, and Ireland definitely knows how to successfully partake in that. Like I said, 97%, that's a very high percentage, and other countries, I believe, should partake in this. Okay, so the last slide I have, in conclusion, each healthcare system has similarities and differences. It all depends on your geographical location when selecting a healthcare system to provide you with their services. So if you live closer to the United States, you might want to partake in the United States healthcare system. But if you are living near Ireland, you can definitely benefit from Ireland's healthcare services as well. In my opinion, I believe Ireland has a better healthcare system when compared to the U.S. healthcare services, just because it's a free service, and they also offer discounts for those looking to move to Ireland in the near future. Again, my name is Tyler, and I thank you for your time.